Welcome to Evidentia, where evidence meets everyday health. Most of us hear the words Union Health Budget and immediately tune out because it sounds distant, technical, and unrelated to daily life. But the truth is, the budget quietly decides where you get treated, how early problems are detected, and how affordable care becomes. So, in this episode, let's talk about the Union Health Budget not as policy or politics but as everyday health impact. The health budget isn't just about the money, it's about priorities. It influences which services are strengthened, which diseases get attention, and whether prevention is planned or postponed. In simple terms, it tells us whether healthcare is being built only for illness or also for long term health. This year's health budget sends a fairly clear message: build systems before celebrating outcomes. There is continued emphasis on district hospitals, emergency and trauma care, public health infrastructure. This matters because most people don't fall sick near large private hospitals. They depend on primary centers and district level facilities. For a patient, this could mean the difference between early treatment or a delayed referral when things have already worsened. The budget also addresses affordability by reducing costs on certain essential medicines, including some cancer and rare disease drugs. For families dealing with serious illness, this isn't abstract policy. It can mean fewer treatment delays, reduced financial stress, and better chances of continuity of care. Small policy changes like this often make the largest everyday difference. There is also growing recognition of mental health infrastructure. For years, mental health sat at the margins of healthcare planning. This budget signals a slow but important shift, acknowledging that mental health is healthcare. Prevention isn't about avoiding disease, it's about addressing problems before they become crises, physically, mentally, and socially. One area that still remains under integrated is oral health and preventive care. Most oral diseases are preventable. They are closely linked to diet, tobacco use, hygiene, and early access to care. Yet, oral health often exists outside mainstream health planning despite its strong links to overall health. This gap highlights why public health dentistry matters because prevention begins long before pain brings someone to a clinic. So, what does this budget actually tell us? It tells us that healthcare planning is slowly moving towards systems and prevention, but gaps remain. It's not a dramatic shift, but it is a directional one. And understanding that direction helps all of us, patients, professionals, and communities, make better health choices. That's all for this episode of Evidentia. If this helped you see the health budget beyond numbers and headlines, follow the podcast and share it with someone who thinks policy doesn't affect everyday health. Until next time, this is Evidentia because prevention begins with understanding.